Welcome back to Section 6 of our course, Understanding Mental Health, a WHO Mental Health Gap Action Program, inspired course for non-specialists. In our last lesson, we explored problem-solving therapy, PST, a structured approach to helping individuals break down problems into manageable steps and find practical solutions to reduce depression and improve well-being. Today, we will explore Motivational Enhancement Therapy, MET, a powerful approach for helping individuals with substance use disorders, SUD. MET is a client-centered, directive therapy designed to increase motivation for change, particularly in individuals who may not yet see the need for treatment or feel ambivalent about changing their behavior. What is Motivational Enhancement Therapy, MET? Motivational Enhancement Therapy, MET, is based on the premise that ambivalence, feeling torn between continuing a behavior, e.g., using substances, and changing it, is a common barrier to recovery. Motivational enhancement therapy helps individuals explore and resolve this ambivalence, strengthening their motivation to make positive changes in their lives. The therapy focuses on the client's own values and goals, encouraging them to recognize the discrepancy between their current behavior and their long-term desires. Through motivational enhancement therapy, individuals come to realize that change is important and worthwhile, and that they have the ability to make those changes. Key principles of motivational enhancement therapy. There are several key principles that make motivational enhancement therapy an effective treatment for substance use disorders. Let's break them down. 1. Client-centered approach. One of the core components of motivational enhancement therapy is that it is non-confrontational and client-centered. This means that the therapist does not push or impose change on the client, but instead uses empathetic listening and open-ended questions to guide the client through their own self-reflection. The goal is to understand the individual's perspective and build a collaborative relationship that encourages the person to explore their own feelings about change. 2. Ambivalence and change. Many people with substance use disorders are ambivalent about change. On one hand, they may recognize the negative effects of their behavior, e.g., health problems, relationship issues, or legal consequences. On the other hand, they may feel attached to the substance or behavior, finding comfort or pleasure in it. MET helps individuals resolve this ambivalence by exploring the pros and cons of their current behavior and the benefits of change. 3. Building confidence. In motivational enhancement therapy, the therapist works with the individual to build confidence in their ability to change. By highlighting the individual's strengths and past successes, the therapist helps the person believe that they can achieve their goals and overcome challenges. The goal is to empower the individual. Rather than feeling helpless or stuck, they begin to feel capable and motivated to make changes. 4. Goal setting and action plans. While motivational enhancement therapy is not focused on teaching skills or strategies directly, as in CBT, it helps the individual identify specific goals related to their substance use and develop a plan to move forward. For example, a person might set a goal to reduce alcohol consumption, attend therapy or support group meetings, avoid situations where substances are available. These goals are grounded in the individual's values and motivations, making them more likely to follow through with them. How does motivational enhancement therapy work in practice? Let's take a look at how motivational enhancement therapy might work in a real-life situation. Imagine a man named Mark, who has been using cocaine recreationally, but has started to experience significant health problems, including frequent panic attacks and an inability to focus at work. He knows his behavior is negatively impacting his life, but he also enjoys the feeling of relief and energy that cocaine gives him. In motivational enhancement therapy, Mark's therapist starts by building rapport and exploring his ambivalence. The therapist asks open-ended questions like, what do you enjoy about using cocaine? What are some of the downsides or consequences you've experienced from using it? How does cocaine fit into your long-term goals for your life? Mark starts to realize that while the substance provides temporary relief, it is undermining his ability to achieve his career and relationship goals. Together, Mark and his therapist set small goals, like reducing his cocaine use by 50% in the next month and seeking support from a group. As Mark works toward his goals, he gains confidence in his ability to change and starts feeling motivated to take further steps toward long-term recovery. Let's pause for reflection. Think about a situation in your own life where you felt ambivalent about change. What helped you make the decision to move forward? How might understanding and resolving ambivalence help someone with a substance use disorder commit to making changes? Change is not always easy, and it's okay to feel conflicted. Motivational enhancement. Therapy helps people work through that ambivalence, making change feel possible. A real-world example. Let's consider Fatima, a 28-year-old woman who has been using alcohol to cope with stress and anxiety for years. She has been feeling more isolated lately, and her family has expressed concern about her drinking. In motivational enhancement therapy, Fatima's therapist listens carefully to her concerns and helps her identify the pros and cons of her drinking. Alcohol helps her relax and feel less anxious. Cons. Alcohol has led to missed work, strained relationships, and health problems. Together, they explore Fatima's long-term goals, such as improving her health, maintaining her job, and building stronger relationships. Fatima decides to cut back on her drinking and commit to joining a support group to help her stay accountable. Through motivational enhancement therapy, Fatima realizes that the benefits of reducing alcohol use far outweigh the temporary comfort it provides. In summary, motivational enhancement therapy, MET, helps individuals with substance use disorders resolve ambivalence and increase their motivation to change. Motivational enhancement therapy focuses on building confidence, identifying goals, and creating action plans that align with the individual's values and long-term desires. The therapy is client-centered, empathetic, and non-confrontational, allowing the individual to take ownership of their change process. In our next lesson, we will move into advanced mental health interventions, focusing on additional treatment strategies for individuals facing substance use disorders or other mental health challenges. Before we continue, here's your final reflection for today. What role does motivation play in the recovery process? And how can you help someone find the drive to change behaviors that are harming them? Let's continue learning and refining our skills for helping individuals take meaningful steps toward healing.